Etiological diversity of secondary trigeminal neuralgia. The main objective of my lecture will be to review all the causes of this type of TN seen in our clinic in the last 6 years. When we classify TN by etiology, we have three different groups. Classical TN includes patients that have a neurovascular contact on MRI. Secondary TN groups patients with neuropathy caused or associated to another disease. And idiopathic TN includes the patients that do not have an apparent cause for the disease. For our study, we conducted a prospective recollection of all the cases of TN seen at our hospital in Mexico from January 2014 to December 2019. All the patients were diagnosed by first doing a complete history and physical exam. We proceeded by doing an MRI or CT scan in order to classify patients into three etiological categories. We excluded all the patients that had evident neurovascular contact or that were idiopathic. The number of patients that were included in our analysis was 252. In this slide, we can see the five main causes of secondary TN. You can see that in the first place we have enlisted migraine. In our sample, 37 patients with long history of migraine that later presented as pain in the trigeminal nerve distribution improved after medical and surgical management of TN. We don't know if there is a pathophysiologic relationship between the two diseases, but we believe this to be an overlap of the two. Therefore, we consider epidermoid cyst as the most common cause of secondary trigeminal neuralgia. The other three causes are postorpedic, meningioma, and multiple sclerosis. In our sample, many patients with postorpedic or MS were found to have neurovascular contact in surgery and improved after the intervention. By using the classification, there may be an overlap of patients classified as STN that in fact have classical TN. This can be explained because patients with apparent secondary TN can have neurovascular contact of the fifth nerve that is not observable through an MRI. We found other 23 causes of TN. It is worth noticing the frequency of postdental and TMJ dysfunction. Underlined in red, we highlight 13 of the 28 causes that are potentially treatable by surgery. TN can be secondary to a wide variety of diseases. The most common etiology of secondary TN is epidermoid cyst. Some cases of migraine, BCV, and MS can have simultaneous neurovascular contact. There is some degree of overlap between primary and secondary TN. 13 of the 28 causes registered in our study required neurosurgical intervention. Secondary TN is potentially treatable and should always be ruled out.